Hi, I'm Maria de la Cruz with the Houston Health Department, and I'm here today to talk about the Affordable Care Act and about the marketplace, the health insurance marketplace. And I have these two wonderful women from these amazing organizations here to help me answer some questions. So, do you mind introducing yourself?
Sure. My name is Melissa McChesney. I work for the Center for Public Policy Priorities.
My name is Trulina Amos. I'm the Director of Patient Access and Outreach for Legacy Community Health Services.
So again, we're here to talk about the Affordable Care Act and about the marketplace and what is the marketplace. But before we start, I think the number one thing people want to know is what are the enrollment dates?
So the enrollment dates this year are November 1st through December 15th. That's when you can come in and get in-person assistance by a certified application counselor, a navigator, or any type of in-person assister.
So ACA is back. The Affordable Care Act is back.
It is the law of the land. It is definitely the law of the land.
Okay.
It's still here.
Why should I get covered, or why should someone get covered?
Sure. It's really important for individuals, first off, of course, to have health insurance. It keeps them financially stable, and when they need to go to the doctor, whether it's for a checkup or because they have some health issue, that means they can actually have the confidence to go and have assistance paying for their health coverage. Also, as Trulina said, the ACA is the law of the land, meaning you will still be possibly facing a penalty or a fine on your taxes for 2018 if you don't get enrolled.
So I'm young and I'm healthy. Like, do I really need health insurance like right now?
Yes, you absolutely do.
I do?
Yeah, we go by the saying here at Legacy and also throughout our community is why wait? If there's an opportunity for you to get health insurance, to be covered, you don't want to wait for an accident to happen. Those are things we do not have any control over. And so during this time from November 1 to December 15th, you have an opportunity to obtain some sort of insurance that will cover you the best way possible and you have those options to choose from. Explore the marketplace.
That's cool, but if I can't do it myself, where can I get help?
You can come to Legacy and get help. So Legacy Community Health Services, we have 31 certified application counselors. They are truly champions of coverage. They have been working with communities and the individuals in the communities since the inception of open enrollment. We have abilities to help anyone from the Montrose area in Houston, Beaumont, Baytown, the Southwest area, 5th Ward, you name it, we're available, and we're available from 8 to 5, Monday through Friday.
Cool. So there's in-person assistance, and I can go to Legacy.
Yes.
I can call this number, right? 832-548-5000.
That is correct.
To make an appointment. And then there's other sisters throughout the Houston area.
Absolutely.
That are part of a collaborative, the Enroll Gulf Coast Collaborative.
Absolutely.
Cool.
There's no wrong door.
Cool.
And so if you're unable to get help from any particular place, just explore your options. If you go to healthcare.gov, you can put in your zip code and find assistance. You can also call our number, which Maria just stated. You can also call the Enroll Gulf Coast Collaborative's number, which Maria, if you could state that really
Sure.
quick.
That number is 832-393-5423. Again, number is 832-393-5423. So that's really cool. And then again, if I need to, I can also just go online and apply myself,
Absolutely.
Right?
It is a process in which you can go in online, healthcare.gov, and begin your process. Creating a password, creating an account, or remembering your account information. Go in there and get started. You can take that initiative, and if you find out that you need help, you can call the marketplace, or you can call the numbers that we just stated to get assistance for that.
Cool. When I enroll, what will be the things that I need to have with me or know in order to enroll?
Sure. One of the number one things, because it actually takes the longest during enrollment assistance, if people forget this, is they need to know their username and password. So if you've ever had insurance through healthcare.gov before, make sure to go figure out what your password was. If you need to reset it, do that before your appointment because it can take a long time in your appointment. So that's the number one thing we hear from as sisters to make sure to bring. But other than that, you need to make sure to be able to express to the person helping you what your healthcare needs are. So that means what doctors do you want to see? What medications do you take, and in what dosages, and how to spell the name of those medications.
Absolutely.
All of those things, if you have those with you, right in front of you, it'll just make your enrollment appointment go a lot faster and a lot smoother.
Cool. So I need to basically understand how much I can afford. I need to know what I need the health insurance for. So like what kind of doctors I go to, my medication, and just my login and my password.
Really
All
important
right,
login and password.
And also your income, knowing your income, bringing your tax information in if you filed that within the last year, knowing that income. You want to be careful with over or underestimating, so as close as we can get to your income is really important. Also, as far as documents, we know in Houston a lot of individuals have lost documents due to Hurricane Harvey, so we ask that you try to bring any type of documents that may need to be verified, photo ID if possible. If you have birth certificates or social security numbers, the reason why is we want to make sure we're spelling names correctly into the system. As for social security numbers, I know my mom does not remember my social security number. So if she was going to enroll me into a plan, which she has done for years, she would ask me what my social security number is. And if she doesn't know, she has social security card. So that's just a quick tip to make sure that you don't run into any verification issues while you're doing the enrollment process.
Good to know. So last year, my cousin enrolled into the marketplace, into the Affordable Care Act. Does he need a re-enroll?
Yes, re-enroll, re-enroll, re-enroll. Shop, shop, shop. If you can imagine that marketplace is like having your basket, a grocery basket, and you're walking through the grocery store and you're looking at plans. I don't know about you, but if I went to the grocery store and they didn't have my favorite cereal, I would have to find another cereal because I just like cereal that much. So you want to shop. You want to take your basket and you want to shop and see what the options are. So please look, and you want to make sure that when you are looking that you're able to find and compare plans. You might have been happy with your plan last year, but this year there may be a better option for you. It's not always a negative. It might be a good thing. It might save you more money. So we ask you to definitely look and see what your options are. Re-enroll, and do not wait. Re-enroll before December 15th.
Cool, but doesn't the system automatically re-enroll me on December 16th if I don't enroll?
The system will, after December 15th, if you haven't enrolled, automatically re-enroll you. But again, like Trelina said, you want to make an active decision and decide, I want this health plan, because even if you liked your health plan last year, the doctors that are in network for that plan could have changed. How they cover your medications could have changed, and definitely the price of the premium could have changed.
Okay.
So you want to go on and make sure that that health plan still meets your needs. And you can only do that up through December 15th. After that, they're going to re-enroll you, and you may not have an option to change the choice that they've made.
Don't wait.
Don't wait. Is it true that the premiums are going up?
So you may have heard in the news or in the media that premiums have increased, and that is true, that premiums have gone up. But what's really important for people to remember, and what's getting lost in the noise, is that financial assistance that is given to each person, most people, 8 out of 10 people qualify for financial aid on the marketplace. It brings down that premium price each month. And as the premiums go up, the financial assistance that's available to individuals also goes up. So the price for a plan for low-income individuals actually will look very similar to the price that they paid last year because their discount also goes up.
Cool. So low-income people can still get covered under the Affordable Care Act for an affordable rate.
Yep, that's
Absolutely.
correct.
For most.
Absolutely.
Awesome.
Don't be afraid to explore. That's what in-person assistance is for.
Okay. So we want to know that the Affordable Care Act is here. It's going on now.
Absolutely.
We have to the 15th, December 15th to enroll.
Absolutely.
You must re-enroll if you have enrolled already.
Mm-hmm.
Know your login and password.
Mm-hmm.
Low-income people can get assistance.
Absolutely.
And the number, what they can call, people can call right now, are those 2 numbers to get in-person assistance, right? So 832-548-5000 or 832-393-5423. Is that cool?
Yes.
Yeah.
And as for legacy assisters or assisters throughout the community, we band together with the Enroll Gulf Coast Collaborative, and so there's no wrong door. We work together. We look for options for you. You may live in a different area, and so we're a team, and we want to make sure that you get assistance during this open enrollment period.
Great. Any other things you guys want to mention before we leave?
Don't wait.
That's it.
Enrolls.